SingHealth is so unique because we have the entire continuum of care from primary to secondary to tertiary, quaternary, and intermediate and long-term care. One of the major strengths of SingHealth as we develop our academic medical center is the strong partnership that we have with Duke-NUS and Duke University in Durham. Duke-NUS brings their strength in medical education and research, and SingHealth brings its strength in the large patient base and the excellent medical care and clinical skills that we have. We come together to focus on how we can improve patients' lives. That's what academic medicine is all about.
What we're here to do is to create physicians that will populate the health systems to help transform and enhance the academic environment in the clinical care systems. All staff across the institution is dedicated to clinical care, but what academic medicine adds to that is an opportunity to learn and experience new and current therapies. It provides an opportunity to teach, and it provides an opportunity to participate in exciting research programs. What we find is that our staff and physicians are quite excited and love to work in these centers because of this sort of exciting atmosphere to end up with what we really believe will be a world-class academic medical center and hope to be one of the best in the world.
We focus on 6 key research areas that address the healthcare issues and disease patterns in Singapore and the Asian region.
Fibroadenomas are very common benign breast tumors that occur in millions of women worldwide each year.
It also turns out that sometimes this benign tumor turns into a cancer, and we'd like to understand the causes for it turning into a cancer.
So we're very pleased to identify the key gene that we believe is responsible for the formation of this very common breast tumor. All these discoveries eventually, we hope, will be translated into clinical applications to be used by the doctors, the pathologists, to help the management of the patients.
So we had 2 studies published in Nature Genetics recently. The first study identified a couple of genes for primary open-angle glaucoma, one of which was the ABCA1 gene, but that also was identified in the second study for intraocular pressure.
We hope that these studies will enable us to firstly detect patients earlier before they get the disease, to understand better the disease mechanism and profile and how they respond to therapy. Ultimately, we hope to develop new treatments for this disease based on the mechanisms.
More than a decade ago, leukemia was considered as a death sentence by many. So the focus of our research is to use new, novel treatment strategies for leukemia treatment, and also to understand why patients develop resistance to certain chemotherapeutic drugs.
We collaborated with Charles, who supplied the patient material, as well as the clinical data. We were able to relatively quickly identify a variant in a gene called BIM. What we were then able to discover was 2 very surprising things. One was that the gene variant that we found was inherited. The second surprising thing was that this gene variant was only present in East Asians. We were able to propose a drug that could overcome this unusual form of resistance. Our discovery was made in a rare cancer, chronic myeloid leukemia, but we were able to apply this discovery to a much more common cancer that's seen in East Asians, called EGFR mutated non-small cell lung cancer, and we see several hundred cases a year alone at the National Cancer Center.
Our continual investments in education resources ensure that our staff have access to state-of-the-art training facilities for effective team-based training.
With the increased complexity in healthcare, it's very seldom that you have one patient looked after by only one healthcare professional. It's always a team. So in order to make sure that all the healthcare providers know what are their own strengths and what are the strengths of the other healthcare providers so that they can actually create a synergy out of this partnership, I think interprofessional learning is critical to ensure that our patients get the best care.
We review and continually develop infrastructure to expand our capacity and improve facilities to address future healthcare challenges.
It's our vision to be able to improve patients' lives. So it's not just about being good in the current context, but really pushing boundaries to set new standards of care in the future.
SingHealth Duke-NUS Academic Medical Centre. Defining tomorrow's medicine.